Fortified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
This place right now. Believe it. Believe it. Believe it. Believe it.
Hello and welcome again to another edition of Health Matters. It is always good to be back on this platform and to bring awareness and education as it concerns your health. Tonight, we will be back. We are back here talking about stroke. Last week we talked about high blood pressure, and so today we are talking about stroke. All you need to know about stroke. So stay tuned. Do me a favor, share the broadcast, and stay tuned as we continue. Tonight, we have with us our very own health practitioner in the house, Health Matters. She was here last week, and she was telling us all about high blood pressure. So we are back again. And it's good to have you tuning in at this time. I want you to know that we are not out of the woods yet. I always like to sound this warning as it concerns COVID-19. I want you to take all the necessary precautions or safety measures that you have to do to keep yourself, your family, and your community safe. Wear your mask, wash your hands, do your distancing, and everything else that you need to do. If you have underlying health conditions, please adhere to the health protocol and to the advice as it concerns, vaccine or whatever your primary physician is telling you. I also want you to know that this platform is to bring education, and we are not your doctors. Whatever you hear on this platform, you need to go back, ask your doctor some questions, because we are giving all this information. We are bringing this awareness and this education because we want you to be safe. We want you to be aware of this different signs and symptoms as it concerns, different illnesses. So tonight, you are welcome again. And I want to welcome our guest again. Now she's not a guest. Our in-house practitioner. All the people on this platform, they're not guests anymore because
Right.
they're just rotational. If you see
Right.
today, maybe she might not come next to Thursday, but she will be here again on another Thursday. So we are just rotating the practitioner, healthcare practitioner, and they are licensed healthcare practitioner. So they're not just telling you from head knowledge, they are trained to bring the information. So tonight, you are welcome again, Selma. You are welcome. And thank you so much for availing yourself. It is a sacrifice, when you give up your time, no matter how little that time, it's a sacrifice because you could have chosen to do something else. Take care of your family, be with your loved ones, do some shopping, whatever it is that you want to do. But you are here with us tonight. Yeah. And so it's a sacrifice. So we appreciate you and we appreciate the work you do. And we say welcome again on Health Matters. This is a presentation by the Fortified City International Ministries right here in Minnesota, USA. You are welcome.
Thank you for having me. Thank you all for listening out there in the world. We appreciate you listening, and we appreciate you joining in every time. I thought it was befitting to bring this topic today to kind of flow with the blood pressure problem. I think it was a better flow so that we can kind of make the connections here. And so again, thank you for tuning in. Yes, Pastor Blay, you did kind of cut into my time here tonight. I was supposed to do my serious workout, trying to get all this COVID-30 out. But anyway, it's all good. I managed to put in, this is what we're talking about. I managed to put in 20 minutes today. So 20 minutes is better than 0 minutes. So I want to thank you for having me. So our topic tonight, we said is stroke. And like I said, I thought it was good to bring this topic in because it will kind of flow with the blood pressure. What is stroke?
Yeah, what is stroke tonight? What is stroke?
Right. So stroke is like an attack on the brain. An attack on the brain meaning the same way you can have a heart attack is the same way you can have a brain attack. So it's an attack on the brain. And basically, there are two kinds of stroke. One of the main things to look out for with strokes is that it's an emergency. So this is not something you want to take lightly. So what is stroke? Stroke is when the vessels in your brain that are communicating with everything else, that are supplying blood flow to your brain, when they get narrow, or when they have like a clot in them, like an emboli, we call it in them, you can have a stroke. And that is, sorry, about, yeah, so that's when you have the stroke. So basically there are two kinds. You have the hemorrhagic and non-hemorrhagic stroke. The hemorrhagic stroke is the ones you get, we call it, you bleed in your brain. So yes, and that's one of them. But they also have several under that one there. And it used to be, a lot of times we call it hemorrhagic and non-hemorrhagic to know how to treat them, because knowing the kind of stroke you had will kind of gear your treatment. So basically, hemorrhagic and hemorrhagic is different pathways, but they all have the same symptoms, okay? So you also have another one that's TIA. We'll get into that. So hemorrhagic stroke is the one you get when you have like a clot in the brain and your brain starts to kind of bleed out. No, I'm sorry. Let me take that back. Ischemic stroke, which is the non-hemorrhagic stroke, is the one you kind of have a clot and they kind of loosen a little bit and break out from the vessel and kind of get into the bloodstream and it kind of block that area where the blood is supposed to flow. That's the ischemic stroke. And that one have population people that have that. That's one of the major stroke that happen. And it's about 85% of people who have stroke have the ischemic stroke. And then you have the hemorrhagic stroke, which is the bleeding stroke, and that accounts for about 15% of the population. And that also, they usually have the same symptoms. So these are the strokes. And you also have another type of stroke called TIA, is transient ischemic attack on the brain. And that usually lasts about, the symptoms and the severity is very short. It does not last long. So basically you have different types of stroke and different type of treatment for the stroke, but they're all emergency situation. Okay. Whether it's a TIA, like we call for the ischemic transient stroke, or whether it's a hemorrhagic or non-hemorrhagic, they are all emergencies, like top emergency.
Okay. And most of the time, the symptoms, I know you told us about the kinds of stroke that, we can have. But what are the obvious symptoms that you can, I'm going towards that? Right. Because there are some signs, Yeah, that are so
there's
visible.
yes. So signs of stroke is called, we call it face. Face meaning FACE. Your face. Look at your face and how your face is. It twisted? Is it one side is up, one side is down? That's one sign of a stroke. And the speech, your speech is kind of slur. It comes out like someone who's drunk, but not really drunk, and it's like your words are kind of babbly a little bit. That's one of the signs of stroke. Another sign is when you have like your arms are weak and you start to get weaker on one side of the body, your arms or your legs get weak. You want to look into that. And so it's the face, the arm, the speech. Your speech is slur. And then the time. It's called, everybody calls it different, but there's face and there's fact. And the other one, the last one will be the time. Time is when you have to get the patient from the beginning of the symptom to when you actually get them into the emergency room. So that's the time factor. That's what will make you survive a stroke, basically, most of the time, is the time factor. Once you start having those symptoms, you want to get into the emergency room. Another symptom you also have is the headaches. When you have, we talked about high blood pressure last time. When you have a lot of headaches and these headaches start to get really unbearable, this is something, excuse me, you have to like go and check it out, because these are some of the symptoms of stroke. So you come in the ED, or you come in and you have this really bad headache that is really not going away. That's something you need to, especially if you know you were someone with high blood pressure, you need to check it out. Or even not, but it's like these severe headaches are signs of stroke also, could be signs of stroke.
Severe headache.
Yes.
And what about weakness, like weakness in the legs and the arms,
Yes. So
does it have something to do?
yeah, so with the weakness can be in your arms or your face. Maybe one side you might not be able to feel it. Your arms are weak. They're kind of flappy. Your legs are weak, and you kind of dragging your leg. Those are really all of a sudden, and these are sudden. Sudden. If you're sitting down and all of a sudden you can't move your hand or you can't move your leg, and that's an emergency if you were otherwise normal person. Yeah, so the weakness in the arm, it could be, and a lot of times it depends on which part of your brain the stroke is. So if you have the stroke is happening on the right side, your arms or if the symptoms are coming from your left side of your body, it's probably the right side of your brain is having the attack. So yeah, you have to kind of take that seriously.
Okay, you are watching Health Matters. Wherever you are, we have our numbers on the screen. It's 952-201-9287. If you are in Africa or in Liberia, you can call us on WhatsApp. If you are in the States, you can call direct and you can use that number. So the number is on the screen because we want you to call in and make your comments and even ask a question. So wherever you are, the numbers are 952-201-9287. 952-201-9287. We are talking about stroke. Last week we were on high blood pressure, and high blood pressure can give you stroke. So stroke, you need to know some of the symptoms, you need to know the signs, you need to know the causes and the types, and how they can be treated. So we are talking about stroke tonight. So having said that, I want to ask our healthcare practitioner tonight, what are some of the causes? I know we dive a little bit in it when we were talking about high blood pressure, but I want us to to go over that again. What are the causes of stroke?
Some of the causes of stroke can be, the number one will be uncontrolled high blood pressure. So you have someone whose their blood pressure is not controlled and is very high, that can lead them into stroke. And so that's why we like to take blood pressure seriously. And another cause could be people with heart problems like irregular heart rate, atrial fibrillation, atrial flutter, because as that heart is beating really fast, and if it's not controlled, they can throw up these plaques, they can throw up these little clots, and that can cause, it can block the airway, they can block the flow of the blood, and that can cause a stroke also. Another cause can be also from people who have a bleeding disorder. Yes, right. People who have bleeding disorder, if they bleed, and if they bleed so much, and they bleed into the brain, it can cause the brain to kind of have an attack. And also you have people who are on blood thinners. So yes, people who have what we call atrial fibrillation, where your heart beats irregularly and fast, and it's not controlled, it can cause, and you're on that medication to control the clots, it can also cause you to have a stroke. So, it's kind of, in a place where you have to be careful when you're on these medications. Last time we talked about breath control. Some breath controls also, they can kind of raise your blood pressure. So if you have someone who has a family history of a bleeding disorder, like someone who has a factor, problem with their blood clotting, and you put them on, and they're taking breath control, that can also lead to stroke. So some women, you see some young women that do have strokes. Like we said, not all the time, but we do see that it can be caused from breath control also, breath control use. So we have to be careful when you get in a family history, you get in a history of this patient or this person, make sure, they're not on, they don't have a bleeding disorder, and you're going to put them on breath control. So, they have to tell you, I have a blood control, bleeding disorder problem.
Okay.
And also alcohol. We talked again last time about alcohol. Alcohol can make you to, if you drink a lot of alcohol, it can kind of lead to you having stroke, because it can kind of raise your blood pressure. It can kind of throw off, and cause you to have throw off these plaques, also cause you to have these ischemic strokes. So these are some of the causes of
What about those like drug users, illicit drugs? That's what I'm talking about. What about what's the risk?
Well, the risk of you having, because when you take like illicit drugs, like these street drugs out there, and it kind of put you at a higher risk of having these problems, because it can also, some of these drugs can make your heart rate beat fast.
Exactly.
So once your heart rate start beating fast, and then you start going into these irregular arrhythmias, we call them, like irregular heartbeat, and then it kind of block the flow of the blood for some reason, you can have a stroke from that. Smoking, we talked about smoking last time. If you smoke cigarettes, it can cause you to kind of, your vessels get really constricted, and kind of raise the blood pressure again. So you do, it can cause you to have a stroke. So there are other multiple factors that can cause. We talk about being overweight and obesity. Can cause that also. So these are some of the factors that can kind of cause that. We also, I think last time we talked about one of the drugs, particularly the methamphetamines. I think I'm not sure. Yeah, they can also cause you to increase your heart rate. Cocaine and methamphetamine can cause you to have a increased heart rate. And back to the alcohol, like you go out on the weekend, or you're drinking these heavy alcohol drinks, that can put you at a serious risk for having that problem, for stroke. And again, before I leave this, when you have these, when you kind of drink and you have high blood pressure, it kind of really makes it, when you have so much alcohol and you're having this confusion, or you don't know that you're having them. So you kind of, play it off and you go to bed, and then, God forbid, it's kind of really bad. So these are the things we kind of want people to be aware of: the alcohol, the smoking, the high blood pressure, the very obesity, very obese people. So we have to be, educating people on that more and more.
Yeah.
So high cholesterol, we talked about that. Diabetes, we talked about that last time.
Yeah. Because most of the time, you see that people with high blood pressure, they always end up having stroke. So this is very, very important. And that is the reason why we want people to be very conscious and want people to, pay attention to all the signs and be able to see your primary care physician. So we want to talk about, I think you made a little mention of the types of strokes, the types of stroke. Is it related, the kind of stroke that you have? Is it only related, to like certain condition? Like if I have high blood pressure, I'm going to have this kind of stroke, or if I'm into drugs, I'm going to have this kind of stroke. Is there something that define them?
No. So there are two kind of strokes. Also, if you have a hemorrhagic stroke, like you bleed into the brain, that can be from just high blood pressure. Also, it can be from these plaques we talk about, having irregular heartbeat. But when you have that, you can have either stroke. So if you have that, it kind of predisposes you to have these strokes when your blood pressure is not, is not control. So by you having, a irregular heart disease, throwing off these clots here and there, and you having, so you can have either stroke, because if you have a high blood pressure and those vessels just pop and they just burst, they will just kind of bleed into the paracamal space, into the subarachnoid space, into the subdural space, and then you kind of bleed out. But if you do have the ischemic stroke, where it's just a clot that's in there, you can also have a stroke too. So it can be from either one. It depends on, it really depends on what precondition you have.
Okay.
Right. So if you have high blood pressure and these vessels are over time, they're being worked, and one day they just kind of burst open, and that's what happened. It kind of bleed out. So.
Okay, so having said that, what are some of the treatment that are available? Because I know, there are a lot of therapy that, must go into this in a lot of time too.
Okay. So for therapists, okay, when someone come in with a stroke, all right, and first thing you want to do is to get a CAT scan. To get a CAT scan at the same time, it's like, I know you guys, a lot of times you have watched these medical shows, but it is really is busy. So while we getting information from the patient, you getting information, you're taking them out. You want to know what their medical condition is. You want to know what medications they're on. You want to know if they had recent surgery. And all of these things kind of play in while you're taking them into the CAT scan to make sure because if you have the CAT scan, it will tell you, okay, this is a bleeding stroke and this is not a bleeding stroke. It's an ischemic stroke or it's a hemorrhagic stroke. So based on that, it would be the treatment. So if you have an ischemic stroke, then you want to do therapy as far as the thrombolytics, where you do that, we call it TPA. And that's very, it saves a lot of lives, but you also have to be careful because there are so many steps you have to take to do that. But when you have one of these, the hemorrhagic stroke, you also want to be careful. You want to make sure you give them medications such as aspirin. You want to try to give them Plavix aspirin to kind of open back those those blood vessels. And also they can do they can embolize the stroke, take them for thromboembolics, take out the part where the blood clot is, and that can revascularize, bring back the flow to the brain. So it depends on what kind of stroke it is, and then you go from the treatment. If you have an ischemic stroke, right away you want to make sure you get that blood pressure down. You want to make sure this patient is not pregnant. You want to make sure they haven't had recent surgery. You want to know all those things that can get your treatment out there. So it really depends on the treatment. So a lot of times we say time. From the time you see the patient, from the time you call someone and they're already not doing so good, you call them, you say, okay, I checked on my mom this morning, or I checked on my dad this morning. She was fine. I called back again. She's not okay. So you want to make sure, like they will always ask you, what time did you see this person?
Okay, we got a caller on the line. He want to ask a question.
What time you last seen this person? Well, I'm listening. Okay.
Yeah. Go ahead. Your name and it's just a first name and your question.
Yeah, my name is Silas. My question.
Can you hear him?
Hello.
Okay. Go ahead.
Yes,
go ahead.
I'm listening.
Okay. My question is. Thank you for actually this informative program that we have. I know most of us will pay a lot to have access to what we're hearing now freely on the air. My question is related to these blood thinners, which are most times recommended, sometimes recommended by healthcare providers for folks who have these blood clot issues, and more especially during the course of this season that we're about to enter into. Now, knowing that as a fight, at what point in time should one try to cut back or have a second thought to maybe go for a checkup to see as to whether you need to continue with the prescribed or non-prescription blood thinners that you are constantly taking?
Okay, good question. Okay, so if you're on a blood thinner, you probably have a condition called atrial fibrillation or atrial flutter. That's a blood thinner. Some people are on aspirin or Plavix, depending on what the condition is. If you have a stent in your heart, they probably will put you on those medications like a cardiac stent. Those medications, now they're getting better. But before, we used to have like someone had a fall, you gotta be careful. You want to make sure they don't bleed. But it's really not a bad medication. It's really not a good medication. If you are on a blood thinner and you feel like you're having a lot of you're having headaches and you are having I think it's something to bring to your doctor. They can probably find the best medication for you. You also have to be on, I know back then people used to be on Coumadin, and you have to do the weekly blood test. But now they bring better medications where you don't get a blood test. But at the same time, you have to still get in contact with your healthcare provider, because when you're on a blood thinner, it's like it's sad to say, it's like a death sentence, because if you have a disorder that you need the blood clot for, you need it. If you don't take it, you might go into a problem and have a blood clot. So it's a hard situation you're in. But either way, you still need to be in it. It has to be within a therapeutic range. A lot of times they like the numbers. I know if you're on a blood thinner, you probably know what I'm talking about. We have to have the numbers between a certain number. If that number is there, we kind of okay. It's less bleeding, and it's therapeutic. We like to be in a therapeutic range. But if you're on a blood thinner, there are better ones out there now that don't cause a whole lot of bleeding, like Xarelto, and there was another one, Eliquis. They're much better now, preferable than the Coumadin. But you can talk this with your doctor. It's really a rock in a hard place, because you need a medication. If you don't take it, you may have a stroke. If you don't take it, it's like, give and take. Yes. But good question.
The person is saying here, what if one is feeling twinkling of the toes and fingers? Please, doc, what are some of the food to eat and what not to eat?
Okay, so if you're having tingling in your hands and fingers, in your toes, that is probably not stroke related. It's probably a side effect from a lot of times when you're having tingling in your hands and fingers, you might want to check if you have diabetes or not. Because when you have diabetes, the nerves kind of they get damaged, so you have those tingling sensation. So you want to check with your doctor. You want to check to see if you have diabetes. Sometimes people have they have diabetes, they don't know either, but diabetes will actually give you the signs, unlike hypertension. Hypertension will basically give you no signs, but when you have tingling in your toes and hands, it will be from you having you got to watch that too. But in your, it could be from you having diabetes. It could be from side effects from something. It could be from, some other neurological disease, but true, it's something you need to look at. But it's not one of the symptoms we look really first for a stroke. When you have a stroke, we look for the things like your speech. We want to look at that to see how you're talking. If your speech is, you're talking to someone, all of a sudden they're really not making sense. They're talking, like that. You want to check that out. You want to look at their face. If they're having like a facial droop, sometimes you will see the whole side of their face droop. You tell them, to smile. Or sometimes their hands get weak or the legs get weak. That's something. But tingling their toes and fingers, there are not acute signs of stroke. So it's something you might want to talk to your doctor about.
Oh, thank you. Thank you. This person says, my uncle had he had a stroke before. What is better to maintain his lifestyle?
Okay. Lifestyle for stroke patients is it takes a lot, because when you have a stroke, you need a lot of rehab. Depending on how severe your stroke is, you need physical therapy. Physical therapy will bring you back to almost back to normal, maybe not all the way. You need speech therapy to help you to learn how to speak. Some people, they have a stroke and they can't eat again, and they have to have a feeding tube, or they can't, so they don't have that reflex anymore. So there's a lot. You need to be on medication to control your blood pressure, because when you have a stroke first, you may end up having another one because you're already predisposed to stroke. So it's like heart attack. Once you have one, within 10 years, you tend to kind of have another one. So it's important to eat a low salt diet, to exercise, to to maintain a low salt diet, to exercise, physical therapy, maintain a life of, try to avoid stress as much as possible. Those kind of things will help you to maintain and stay active. Stroke is not a death sentence. You can still be doing things and moving around. I think physical therapy is one of the rehab. It's one of the big things that stroke patient can get, come back to. Once you get over that time in the hospital, you get in the rehab, is great. And also, I know we look like we're going to be short on time here, but I want to say, especially this is important for Liberia, or countries that are less developed or something. When you have these problems, I'm going to be honest with you. When you have a stroke and your stroke is right now, we need to treat it right now, because stroke is an emergency.
That's right.
If you don't treat it, and you take the time we take to go to other country, you buy time. You're like, by the time you get there, 5, 6, 10 hours, you already passed that treatment time. So they're just maintaining you until because when you need a place that can treat you, you need people. Now we have stroke centers, but we need stroke centers, or maybe not sophisticated, but you need a center that can treat you for stroke and get you treated. Because once you have that, you need 4 hours. Maximum is 4.5 hours. But from the time you are down, from the time someone see you that you are not well, they take you to the emergency. They start treating you straight to the CAT scan. By that time, we're trying to get all the information from you. by the time you get to the CAT scan, we get the dependent. By the time, we get all of that result from the CAT scan. Okay, this is not this stroke, it's this stroke. Then we kind of work our way down. But time is of essence. You can't wait 6 hours and then, you expect it to be coming back to normal. I think this is why one of our biggest problem is we wait until it's 2-3 days later, and then this person is way past the treatment time, and it's just rehab. And unfortunately, a lot of time, we don't even make it. So stroke is preventable.
Okay. Hold on. You want to call your name and you want to ask your question?
My name is Taslim Ahmed, and my question was, can drinking water help prevent a stroke?
Can what?
My question was, can drinking water help prevent a stroke?
Drinking what?
Can drinking water help? Can drinking
water help prevent a stroke?
Can drinking water help prevent a stroke?
Well, here's the thing. We all need at least 6 to 8 glasses of water a day. Okay, so drinking water, it may just keep you full, keep you hydrated. I wouldn't say it's going to help prevent stroke, but if you're drinking water, you're kind of cleaning out your system. If you're not an alcohol drinker and you're drinking water, that's fine. It's not going to prevent a stroke, but if you're drinking water, that's kind of a good behavior to drink water and not alcohol or soda. So by you not drinking the soda or the juice or the Kool-Aid or the Hawaii Punch, all of that is Kool-Aid and all those, you kind of, watching yourself too to what you put in your body. So it's a yes and no question, but what you need is you need to get your blood pressure not elevated. So lowering your salt in your diet, lowering your oils, because if you eat a lot of fatty foods, you get cholesterol problems. So I wouldn't say it's going to prevent you from having a stroke, but I mean, we all need at least 6 or 8 glasses of water a day from morning to night every day. So I would say it's a thing to kind of, just drink your water, but it's not going to prevent you from having a stroke.
Okay. Thank you so much.
Thank you for the answer. Goodbye.
Okay, bye. All right, we got a couple of questions here. The person say, a few days ago, my aunt was diagnosed of having fat in her blood. What does that mean?
Fat in her blood. I'm not sure what this means, but when you say fat in the blood, I want to really think it's cholesterol.
Yeah.
Okay. So if someone is having fat in their blood, and it depends, there are 4 different kinds of cholesterol. And the one we don't really want to get high is the one they call the LDL. And that is if you always remember this, the lethal dose cholesterol, lethal is L, and and HDL is the good one. So we like that number to be under 99, under 100. If that's high, that's going to can predispose you to have high cholesterol. And that's the number we really don't like to be high. So that is not a good thing if you have a high cholesterol, because high cholesterol can kind of make your arteries kind of tight and kind of clog your arteries, and that can be a problem for high. That's a prerequisite for stroke.
And the person have a question here, and they say, is blood thinner can be taken for a long time? I mean, can you take blood thinner for a long time?
Yes, you can take blood thinner for a long time, because some of these diseases, like you need to be on a blood thinner for a long time until it's corrected. And if you are someone who have if you have if you have a stent in your heart, you might be one of those that are going to need long-term, be on a long-term blood thinner. But now, like I said earlier, we have a lot of better blood, I shouldn't say better, but we have improved blood thinners side effects, so it doesn't cause all these lot of bleeds and all these serious bleeding complications. But it's something to look out for if you're on a blood thinner. Excuse me, you don't want to be, you want to make sure it's in a therapeutic range. You know, like the ones we have now, you don't have to do the blood work every week, so it's much better than the ones people used to take back then. So it can be lifelong, especially if you have a valve disease that they have an artificial stent or stent. You need to be on it for a long time.
That's it. That's the answer to that question. Thank you so much, our healthcare practitioner tonight, Selma.
So
And there are comments here. Yeah, that you already answered. Someone said that. Okay, yeah, there are things that we already talked. Okay, there's a question here. Let me tell you, she's still asking the question. Okay, I don't know whether it's down here, but she sent it on this. Let me see. Okay, all right, this is it. She said, "What if one feels the same tumbling on the left feet of their chest, left side of their chest, like your heart, tumbling off and on or something,
All right. I'm not sure where is this what the tumbling, but there are a few things, when you have a heart, some people have a hard time explaining what is going on in their heart. Sometimes people's heart be shaking like this, like boop, 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 like shaking.
Yeah.
That is what is called fibrillation. So if that's happening, it feels like your heart is jumping all the time. Also, people can have palpitations where your heart just beat off and on very fast, like when somebody's running behind you and you're like running really fast and your heart is racing, but it's like really beating hard. And it starts for a while. That's something you need to check, because a lot of times when you see that happening, you want to make sure you don't have a thyroid disease. You want to make sure you don't have a heart disease, because when your heart is doing that, it means like it's not right. It's an arrhythmia, and it's not good, because it can be doing that. It can also put you in some I want to say funky rhythms, but it can also put you in some where you have to, like, it's not good, because if that, sometimes those are signs like this, something is wrong. So you need to check it out, because a lot of times, if you're a woman or if you're a man and those things happen, especially for people who drink heavy alcohol, things like that, and they're predisposed, alcohol, drugs, and not eating right, you kind of put yourself at risk for having these heart irregularities. And a lot of times, when you reach a certain age, things don't always work the way they need to work.
Yeah.
You start having all these heart palpitations and atrial fibrillation. You feel like your heart is skipping a beat sometimes, and sometimes it could just be from you not having enough electrolytes in your body, like your potassium, your calcium, your magnesium. So if you have that too, check it out with your doctor. They can run some blood tests and see what's going on. Or, if you're in a fancy country, they can kind of say to see a cardiologist. But if you're in a country where there is lack of, like all these specialties, then you kind of have to be
They
careful.
want to know whether aspirin can prevent stroke.
Okay, aspirin. Aspirin does prevent stroke, especially for people who have cardiovascular disease, like people who have the hypertension, the diabetes, the high blood pressure. A lot of times we kind of put them on aspirin so that they kind of keep the blood flowing well, because remember, aspirin is also a blood thinner. So it's not just the warfarin or the Coumadin and the Eliquis and the Xarelto, but aspirin is also, and that was one of the first things they used before they developed all these fancy medications. So aspirin can prevent stroke, but however, you have to be careful, because aspirin is also a blood thinner. So it can thin your blood to, leak into the vessels, and then you can have a stroke.
Is there any social habit to avoid in order to prevent stroke?
Social habit to prevent stroke. I would say smoking
Yes, we
will be
talked
one
about
of them. Drinking will be another one.
that.
And drugs will be one of them. So if you do these things, you want to stop that. Yeah, you can drink moderate, but some people, they go on these binge drinking, and that's not really good. So you have to be careful. Drinking, smoking, alcohol, all those kind of things, drugs can kind of predispose you to having a stroke. And one more thing I want to say here also, I'll get this question here.
Yeah, yeah.
You also want to be careful with I keep going back to the pregnant women. A lot of times when you're pregnant, your whole body is in a hypervascular state. So everything is kind of, you know, like highly vascularized. You tend to, so you got to be careful with pregnant women. You want to control their blood pressure. You want to control it so that they don't have stroke. Because, you see that sometimes people have a stroke after they have a baby, and people wonder why. So it's important to treat pregnant women, treat their blood pressure, treat their symptoms, and make sure they're good. What's the difference between hypertension and high blood pressure? It's the same thing.
Mm-hmm.
High blood pressure is hypertension.
Yeah.
The medical term is hypertension. What
Mm-hmm.
is cardiovascular disease? Cardiovascular disease is a mixture of diseases like high blood pressure, congestive heart failure, where the fluids kind of just hang out in your lungs and don't move anywhere, and it can cause you not to breathe well. It causes you to be short of breath. It causes your hands to be all swollen, your feet to be swollen. You're very tired and you can't walk. Those are kind of cardiovascular disease, heart disease, cholesterol. I think we talk about that. Those are cardiovascular diseases.
Okay. Oh, there was a question you were answering before I brought in another question. The president sent a text here that said you did not finish and I cut you off. So I think it had to do with the tumbling on the left side of the chest and like the heart tumbling off and on. I think, she said you did not conclude your statement. So you want to just,
Okay,
give a
that's
summary
good.
of that. Yeah.
So if I don't know if tumbling is the right word, but if you having like your heart is beating
Yes,
fast,
you are talking about palpitation.
right, palpitations,
Yeah.
those are something that need to be looked at because, like I said, your heart may be having palpitations from not having the enough calcium or low calcium or high calcium or high potassium. So we call it electrolytes. If you're not having enough electrolytes, or it's too much or too little, it can cause that. If you're having a disease like atrial fibrillation, it can cause your heart to kind of beat irregularly. Like it will beat, and it will kind of slow down and beat. So that's something you need to look at your doctor for. They can check you out for that. And that's also cardiovascular disease too.
Okay.
Mhm.
So like she's just said, you can look at your doctor. That means you can check your doctor so he can or she can do what the necessary, tests that they need to do and figure out what exactly is going on with you. Yeah. So there's so many how long before a stroke, maybe how long you got a stroke just
Okay, how long before a stroke symptom start?
yeah.
Stroke symptom is very sudden. Like it's very sudden. They used to call it cerebral vascular accident, CVA, but we're trying to get away from that because it's actually a brain attack. So it can happen suddenly. You can go out to the market right now, come back home, sit down, and have a stroke. So yeah, so it's very sudden. So from the time you are talking until the time you stop talking, that's how sudden it is. So someone can be sitting here, someone can go upstairs and come downstairs and say, "Oh my goodness, I was just talking to the person and I'm trying to, get their attention. They're not looking." A lot of times, something to look out for also for the stroke. They're very sudden. So let's say you and I are having a conversation right now, and all of a sudden, I'm not even looking at you. I'm looking at somewhere else, and you're trying to get my attention. So I'm looking away from you, and I'm kind of basically kind of cutting you off over here. So that's a sign of stroke also. So you gotta be careful. It's called a gaze thing. And someone, so that's important. That the speech, they're not looking at you. They're not, they're completely, their whole side is neglected. That needs to be checked out like right away. Stroke is an emergency wherever you are. Is an emergency. You need to get to the hospital, and they need to treat you. So that's what before a normal stroke does. So this is a good question. Okay, I kind of for the sake of time, so I'm going to answer this question here. I have time. Don't worry. So for when you have a TIA, ischemic attack, it is it can be a warning sign for a stroke, because these are little things that are telling you there is something wrong here. Take care of this. Maybe I need to be on my aspirin. Maybe I need to be on my cholesterol medicine. Something is going on. Maybe I need to really control my blood pressure, because an ischemic stroke, it's a temporary. If you're talking about ischemic attack, it's temporary. The symptoms go away, but they may come back as a severe stroke. So these, sometimes I like to say ischemic attack, TIA, is like a warning sign. And some people all their life, for some reason, they have this ischemic attack. One reason they have an ischemic attack, 2 months, 3 months later they have, so they have to go in and really check to see what is going on with this person's vessel. And this is when you're going to have all these fancy, angiogram and making sure your vessels are all clear. Yeah. But it can be temporary, but it's not always temporary. So it can be a warning sign. Some people, they may be the only warning sign they get before they have a severe stroke. And, stroke is an emergency. The time you take to get to the hospital to be treated is that time that we're looking at. If you come after 5-6 hours, it's really in a recovery stage. It's not acute. It's acute, yes, but it's going to be hard to take care of. There is no hospital in a place like Liberia. A relative developed a stroke. What should I do? So, Mr. Jensen, this is the problem. We need to get our legislator, our government, our officials to get hospitals in each area, like in these cities. I'm from Liberia, and I know we need, because this is one of our major problems. If we don't treat them acutely, we wait to go to Ghana. When you get to Ghana or Nigeria, you're not on that priority list.
No,
you're not, because you already have a stroke. So they're just maintaining you by going there. It's just, maybe you're going for rehab or something, but you need to be treated in a place, because mind you, this is 4 hours. We need to have the ambulances. When you have these symptoms, ambulance supposed to come and take you straight to the hospital. That's why we have this problem, because we have these, we don't have the hospital, and we need CAT scan machine, we need MRI machine to wake these people up, because you can have a stroke and you can recover here by this test. And that's unlike Liberia. We need to have the hospital. You need a hospital right there in every place. You need to have a hospital that have these machines to wake people up. If I'm having a stroke, or if I'm having if I'm having a pneumonia, if I'm having shortness of breath or something, I need to have a hospital right there where I can be treated. Because by the time you get to a foreign country, those pass the line. So you just go in there for them to give you the same aspirin or same, atorvastatin you should have gotten in the beginning. So primary care. What is it? What causes pain in your heels? Pain in your heels. It could be from what part of your heels? On your heels, on your whole leg. Pain in your heels can be from just overworking, or it could be from claudication. If you're walking and you're having pain in your legs, that's not good. You need to check out again to make sure you don't have what we call this intermittent claudication, where the blood is not flowing a lot in your foot, and then you have this pain when you're walking. And also when you have diabetes too, it can also affect the pain sensation in your legs. So you need to watch that. But that would not be a sign of stroke. But that's a good question, because when you have peripheral vascular disease, or that is another problem that can cause you that your blood flow is not flowing well. So you need to check that out too, because you might not have a good blood flow and you don't want to end up with a one limb. So that so you want to make sure there's good blood flow. If you continue to have pain in your heels, it's something you need to tell your doctor about, and have it checked out. They can do some tests. They can do some tests, because you want to make sure it's not diabetes or it's not a vessel problem.
Okay, thank you so much, Selma, sorry. Thank you so much. Thank you so much. We have had, a lot tonight. I didn't expect us to even stay the whole hour, but, we almost an hour, we just.
Right. And we didn't even cover all the bases.
Right?
Okay.
Because there was so many questions coming.
Yes, that's okay.
So many questions.
Right. That's okay.
Yeah.
I think the main thing, I'm going to be honest, in America, we have all the technology and we have all the healthcare. But look at Liberia, we don't have that. So that's why people are having a lot of, deaths from stroke. Because, when you have a stroke, it has to be taken care of right then and there. You don't wait 2 days later. You don't wait 5 days later to go to the hospital. If you're having these, like you look at mama don't look well, papa don't look well, take them to the hospital, and let the doctors take care of them. And then having a CAT scan right away to make sure they're having, whatever, bleeding stroke, that way they can treat them there. But it's important to have a place where everybody have, access to the hospital. So it's not just one thing. We just have to keep working around and talking to our officials so that when they too have a stroke, they can be able to get taken care of, because we need hospitals everywhere. Like in the big cities, you need these hospitals. In every county need a hospital. So that's how it's going to work. That's how we're going to live to be, live longer, because this is what, longevity is. It's not just, going out every night, but longevity is eating well, living well. Living well means you need a primary care. You need a doctor to look at you, doctor to check your blood pressure, doctor to check everything. But, and that's what we need to be, focusing on right now. And don't lose a lot of people, because one of the biggest thing with stroke and these accidents, it's a lot of rehab that's involved. It's a lot of therapy that's involved. So you need all of them in place. It's a long road. Some people might take a shorter road based on what part of the brain is affected. Some people may not be able to speak again. Some people may not be able to walk again. Some people may not be able to swallow again. So these are all these things that need to be taken into consideration. So we need to be more, aware of how to take care of stroke. Stroke is time. Brain is time. Brain. You got to be in a hospital from the time you start getting these changes, and you got to be there within 4 hours. They have to start working on you between your symptoms, the CAT scan, and treatment. So that's the stroke
conclusion
lecture tonight.
Amen. Thank you so much. I really appreciate you, Selma. Thank you for availing yourself. Thank you for the information that will pass on. Wherever you are tonight, you are healed. And this is the program, You Are Healed. And this is Health Matters. Your health matters. So take care of yourself. I decree and declare, according to the word of God, that you are healed. So whatever the ailment in your life, make sure you take care and go to your hospital, your physician, primary care physician, or whoever you see, and tell them exactly what is going on with you. Remember, the doctors, they treat and God heals. God is the healer. He reigns supreme over everything. His plan for you is to ensure, that all the good things come to pass for you to fulfill destiny. So in order to fulfill destiny, you have to be well, you have to be strong. So wherever you are tonight and you are not feeling well, by the straps of Jesus, you are healed. I speak healing to your spirit, your soul, and your body in the name of Jesus. With long life, he will satisfy you and show you his salvation. You are blessed in the name of Jesus Christ of Nazareth.
Amen.
Have a wonderful time, and we will be here next week, the same time, for Health Matters. Your health matters. Thank you for joining us.
Thank you.
Sharing the broadcast. Thank you so much, Selma. This was really, really awesome. Really awesome.
I hope so. I hope we learn from this.
Wonderful time. Yes, I did. I learned a lot of things here tonight. And I'm glad our viewers, they were very interactive.
Yeah.
Also have fun. So thank you so much. And we will be back here. Thank you, our viewer. God bless you. Good night. Or good morning, wherever you are.